I have severe localized pain in my upper right quadrant near my belly button after my tummy tuck. It is tearing, pulling, ripping, burning, stabbing pain that comes and goes with no consistency. But it is intense. Please help.
Dear Wright, I am sorry you are having incredible pain. First, it is important to know how long ago was the tummy tuck, and then how long after the tummy tuck did you begin having this pain. When a tummy tuck is done, there are two muscles that are usually brought together. These are vertical muscles that run from the ribs down to the pubic bone, known as the rectus abdomini. First, the skin is lifted from an incision just below the hips, the umbilicus is cored and released from the skin. The skin is pulled back and very heavy nylon-type sutures are used to bring these muscles together. In women who become pregnant, these muscles can push apart from the pregnant uterus. They never go back on their own, and each person is different in the degree of defect as a result. The heavy sutures are tied together and often buried along the rectus sheath, usually near the belly button. I hope I am not boring you. The pain can be from many reasons. It can be from the knot that was buried near a nerve, or if a nerve was trapped in the suturing, if a nerve was injured and that nerve is growing abnormally, or if it not related to the surgery. There are a couple of things that can be done, and this needs to be done someone who is qualified and knows neural anatomy thoroughly. You see, CT and MRI may not show these sutures because their density does not vary much from the surrounding tissues, and if there is scarring in the area then it becomes confusing. First, A through physical exam, with eliciting of the pain by digital exam and localizing the source of the pain. A diagnostic nerve block if not performed yet. With the use of a very thin needle, local anesthetic may be injected in the location to see if there are any changes or relief in pain. From there it can be determined what to do next. Sorry for the long answer. A real thorough knowledge of these problems are needed. I have trained as a chronic pain specialist from Memorial Sloan Kettering Cancer Center and taught the techniques at Yale University. Positive feedback is appreciated. Do not hesitate to ask questions for further clarification. Drive. Ketch.
I'm 27 years old, very young and scared. The tummy tuck was performed on June 24th of this year. About 1 month after surgery, I felt extreme pain by my belly button where the suture was tied off. I went back into surgery to get the suture removed in hopes of pain relief on August 25th. I have had no relief.
It is possible that you may have caused some trauma to the underlying tissues, muscles, etc.
I have visited many doctors, plastic surgeons and general surgeons, none have an answer. I'm finding out that my muscles should have never been plicated in the first place. Whenever I lay to the left and breath in, it kills. Sometimes when I lay on my back it kills, but also the pain is never consistent with any movement. Is there anything that they can be missing, don't know about? Is there any way to test the possibility of nerve damage other than nerve blocks? Or can this be muscular? Or anyone you can refer me to, I will travel wherever I need to take care of this. Also, I did have a nerve block 3 days ago. Since then my pain has become worse. I have never had children and am very afraid. This crazy stabbing, burning, tearing pain is crippling me. I am sorry for the lengthy message and greatly appreciate you taking the time to answer. Thank you so much.
Dear Wright. Well, yes. I am certain there is a muscle component to the pain. The nerve block you are referring to eludes me because there are many different nerve blocks. Did they actually inject in the area of the pain, or along where the nerves would be coursing? I would not use steroids. Steroids can sometimes cloud or confuse results, as in your case. I would use straight local anesthesia and inject in the area of most pain. Again, I have not had a chance to actually examine you. Sometimes I talk to people about their pain problem on the phone, then when I meet them it is totally not what I had in my own mind. Has a lot to do with terminology and description. I would not know where to send you, because I do not know where you live. Don't be scared. I understand that your surgery did not go as planned. Let's take this one step at a time. Let me know how else I can help you. Drive. Ketch.
I live in the Metro Detroit area. The pain specialist did put lidocaine, Marcaine, and steroids in the spot of most pain. Should it have already worked, and why would you not have used steroids? What muscle component could there be? Please, if there is anywhere you can refer me to, or if I can talk to you over the phone, I would be so grateful. What can I do to ease this pain till I find out what it is? And what is the difference between muscle and nerve pain symptoms? I was not even told to be careful with movement immediately post-op, and I tried laying on my belly and stretching out and felt terrible pain. I also fell in the tub and threw up because of the stomach flu about 5 weeks after op. And the pain started a week later. Please, if there is any way you know how to help.
Thanks for the additional info. I can tell you are having a rough time with this. First, calm yourself. It is possible that you may have caused some trauma to the underlying tissues, muscles, etc. On fresh surgery. Don't panic yet. Nerve pain is more like electrical in sensation. Ever hit your funny bone? Sort of like that. Muscle pain is from muscle. Ever pull a muscle real bad? Sort of like that. You know that we are going beyond the scope of this help site if I start giving out treatment plans and options. Let me know. Drive. Ketch. Dear Miss Wright, I am not familiar with the care providers in your area. Not sure who to refer you there. I am on the East Coast. Most of my referrals are in the Northeast. Sorry. Drive. Ketch.
If you know someone very good, I am willing to travel. Do you have anyone in mind?
They may be quite a distance. My referrals are in Florida, New Jersey, and here in CT. I may be able to save you the trip if I can talk to you and get a better understanding about your pain. Did you mean to send more payment through JustAnswer? Drive. Ketch.
Okay, then please call me at 1585 to 7,182,079.
It states that it is not a working number. Call ###.
Thank you so much for your help. You have been so great to me and so caring. Thank you for taking your time on a Sunday night to help me. I wish all doctors cared as much as you do. Sincerely, Natalie.
You know, this is my life. This is what I do, help people almost around the clock. I find it rewarding to take care of challenging situations. I love seeing relieved faces. I was not able to see your face, I am sure there is a little relief. I hope I was able to help you and we will know over the next 2 or 3 months. Let me know. Merry Christmas, LOL Dr. Ketch.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.